Welcome, everyone. It is great to see you here today. I'm Phoebe Walker. I'm the Director of Community Health at the Franklin Regional Council of Governments. The COG is the host of the Franklin Hampshire Training Hub and also provides some staff support to Western Mass Public Health Association. And those are the two co-hosts of this session. We are super excited to bring you a wealth of information today about how air quality affects health, how the state and regional partners measure it, and how you can use that data to improve health outcomes where you work. If you wouldn't mind putting your name and affiliation in the chat so our presenters can see who's here, and please make sure you are muted. We will take questions after the three presentations, and we will definitely be recording. We are, in fact, recording the whole thing, and we'll send out the handouts and YouTube video to everyone who registered. So we are going to, the agenda is going to go like this. Addison Fry from DEP is going to kick us off with what the state monitors and how. And then Kate Adams from DPH will cover how we protect health from air pollution. And finally, Francesca Bermudez and from the Public Health Institute of Western Mass and Billy Spitzer from the Hitchcock Center for the Environment will share a great new app that's using sort of hyperlocal air quality data to give us all better information. So I am going to turn it over to Addison. Take it away.
I'm going to share my screen. Can everybody see my screen? Yeah, cool. So hi, everyone. My name is Addison Fry. I am a community monitoring analyst with Mass DEP's Air Assessment Branch, or AAB. Today, I'm going to give a brief overview of air quality monitoring in Massachusetts, a current grant opportunity for communities to contribute to the monitoring, and where all of our air quality data can be accessed. So Mass DEP AAB conducts regional regulatory air monitoring to ensure the state is compliant with the Clean Air Act. We have 26 sites across the state where we measure criteria pollutants. Criteria pollutants are a subset of pollutants that are directly regulated by the Clean Air Act and have a National Ambient Air Quality Standard, or NAAQS, to which they are compared. Criteria pollutants include nitrogen dioxide, sulfur dioxide, carbon monoxide, fine and coarse particulate matter, and ozone. We also measure a handful of non-NAAQS pollutants like ultrafine particulates and volatile organic compounds. These are important as they can answer different types of questions. So for example, ozone is a secondary pollutant, meaning it's rarely directly emitted. It forms via a chemical reaction between heat, light, and other organic compounds. So measuring ozone precursors provides valuable information. We also conduct community monitoring projects that involve lower cost, non-regulatory sensors to provide hyper-local air quality data. This type of monitoring is fairly new at Mass DEP, having only started about 5 years ago. We have sensors that measure for criteria pollutants as well as non-criteria. And this data is strictly non-regulatory and is primarily used for informational purposes, like deciding if you want to participate in an outdoor activity or keeping your windows open or stuff like that. This slide shows a side-by-side comparison of sensors versus regulatory monitors, highlighting the key differences between the two. So benefits to the sensors is the lower cost. Prices can range drastically by sensor type, and there are oftentimes additional costs like cellular fees or data platform fees associated with sensors, but they can range anywhere from around $300 for something like a Purple Air or up to like $12,000 for something like our fine particulate sensor. While monitors, on the other hand, start at around $15,000 and can go up into the 40s. Get up into the 40s, and that is the monitor only. That does not include any other operational costs like calibration gases or temperature-controlled shelters that a lot of them require to operate. Sensors, as mentioned before, have less strict siting requirements. So we are able to really get that hyperlocal information, but the data is strictly informational, while the regulatory monitors allow us to collect that regulatory grade data that can be used for enforcement, but they have very strict siting requirements and operating criteria that's dictated by the EPA. This slide shows the NAAQS. that the regulatory data is compared with. As you can see, each parameter has a different metric. The big hitters here that you'll hear a lot about are ozone and fine particulate pollution, or PM2.5. The ozone NAAQS is 70 parts per billion over a rolling 8-hour average. So the calculation for, say, 8 a.m. would be starting at hours 1 a.m. through 8 a.m. And for the Clean Air Act, the fourth highest daily maximum, that's a mouthful, is averaged over 3 years, and that's how they decide if we're in attainment or not. The daily max for PM2.5 is 35 micrograms per cubic meter, and for attainment with the Clean Air Act, it is compared to the 98th percentile of daily concentration averages, also over a 3-year time period. MassDEP offers an air quality forecast where you're able to look out up to 2 days to get an idea of how expected pollution will compare to these standards. There's also an alert system that you can register for to receive notifications when the predicted concentrations are outside of the good criteria. So how can communities participate in this air quality monitoring? We're in the middle of our 3rd round of our air sensor grant. This grant is open to municipalities, nonprofits, community organizations, and tribal organizations, where applicants can receive up to 5 purple air sensors. These are low cost, low maintenance, fine particulate sensors. All they need is an outdoor power supply and Wi-Fi. Our goal with this grant is to increase sensor density across the state, both on the purple air and EPA fire and smoke maps that I'll talk about here in a second. Improve community access to local air quality information, and also empower communities to conduct their own air quality studies. Here are some examples of how past grant recipients are using their data. Some have created their own dashboards that residents can subscribe to for email alerts, shown here on the right. Students have won national awards for projects conducted using this data, and a ton of communities have linked the Purple Air Map to their town websites. So where can all this data be accessed? For regulatory data, MassAir is the current platform to view all of this, as well as the forecast. This is also where you'll go to sign up for the notifications for the forecast if you're interested in that. To download regulatory data, everything is available in the EPA's Air Quality Systems, or AQS database. If that's something you're interested in, I would recommend reaching out to either myself or someone else on my team. The coding for that can get kind of complicated, but we're happy to help if you want to download that data. Purple Air data is available to be viewed in real time at purpleair.com. Data can be viewed as raw values or corrected, as they offer a handful of pre-programmed correction factors, including the EPA correction factor. And you can download data here also in different averaging intervals. The EPA has a fire and smoke map that displays purple air sensors, another sensor called Clarity, and regulatory monitors on one map. This one's helpful because they have a QC procedure happening in the background that removes malfunctioning sensors. So here's an example of that. Both of these images were taken on the same day at the same time, and on the left is the purple air map, and there's 3 malfunctioning sensors. There's one in the 300s that's obviously not reading correctly, and 2 that kind of look transparent, and those have been downgraded because they have poor channel agreement. And you can see on the picture on the right, which is the fire and smoke map, all 3 of those sensors are not present and polling to the map. So I'll put together a document that Phoebe will distribute that has detailed information on how to get all this data and all the information I just provided. So if anybody has any questions on any of that or anything that I went through in this presentation, myself or anybody else on my team will be happy to help.
To Addison. I know some folks asked whether there's a flyer available, and Allison has also been putting some links in the chat. So I think she could probably answer that as we're going. And just for everyone, as you have questions, stick them in the chat, and we'll also pause at the end. But we've got lots of folks with lots of knowledge on the call who can hopefully answer some of them in real time. Okay, we are going to shift over to Kate Adams from the Department of Public Health. Let's see here. Is everybody, let me make sure that you're seeing the thing you should see.
The right slide.
How's that look?
There we
Good.
go.
Okay,
That looks good.
take it
So
away,
good
Kate.
afternoon. Okay. Good afternoon. I'm Kate Adams. I'm an epidemiologist from the Climate and Special Projects Program at the Department of Public Health. And today I'm going to talk about both the health impacts of air pollution and also how to protect health from air pollution. Next slide, please. This is a brief overview of what I'll be presenting today. Air pollution is a serious health issue in Massachusetts, particularly since we have some of the highest asthma rates in the country. The 2023 Resilient Mass Plan, which is the statewide climate plan for Massachusetts for the 2023 to 2028, identified degraded air quality as a climate change impact of critical concern for human health. Next slide, please. I'm going to start with, there are two major pollutants that are of concern. Well, there's many pollutants that are concerned for human health, but the two most critical in Massachusetts are ground level ozone and particulate matter less than 2.5 microns. And ground level ozone mostly results from combustion emissions, including traffic-related air pollution. Ozone is a powerful irritant with a number of health impacts related to how it can irritate and inflame our eyes, nose, throat, airways, and of course, lungs. And this can result in flare-ups of COPD and asthma, general eye, nose, throat irritation, and respiratory inflammation. Purple air sensors usually measure PM 2.5 only, but DEP does have some smaller sensors around the state measuring ozone in addition to their larger monitoring stations. Next slide. Particulate matter less than 2.5 micrometers in diameter is a mixture of many different types of particles. Some of these come from fossil fuel combustion and wildfire smoke, and some of them come from natural sources like dust, sea salt, particles kicked up during mining or industrial operations and so forth. Studies of PM 2.5 over the last 30 or so years have found both long and short-term impacts, particularly for heart and lung diseases. PM 2.5 is small enough to reach deep within the lungs and then pass from the lungs into the bloodstream, where it then gets into the circulatory system. Short-term impacts of PM 2.5 include asthma attacks and COPD exacerbations, heart attacks and strokes, and just general irritation of the airways. Longer-term impacts include lung cancer, the development of asthma and COPD, and cardiovascular diseases. PM 2.5 is also associated with adverse birth outcomes and pregnancy complications, and this may be due to its impact on blood vessels, as in with the cardiovascular impacts. Next slide, please. To help message the short-term health hazards of PM 2.5 and ozone exposure, AirNow created the Air Quality Index, or AQI. The AQI is based on the National Ambient Air Quality Standards, or NAAQS, that are set by the US EPA and that Addison just discussed. AirNow, Purple Air, and DEP's Mass Air and other pollution monitoring and sensor systems generally present air quality numbers according to this color-coded system. AQI values above 100 indicate air pollution levels that may be unhealthy for sensitive groups, with the AQI of 100 equaling the short-term National Ambient Air Quality Standard levels, which for ozone are 0.07 parts per million, and for PM 2.5, it's 35 micrograms per cubic meter. Next slide, please. Nearly all AQI-based guidelines for protecting health mention sensitive groups. And this is a clip from the chart you just saw as an example. What they mean by sensitive groups are people who are at higher risk of elevated levels of air pollution. These are some examples of persons who are more likely to experience health impacts at lower warning levels for air pollution. Those include people with heart or lung disease, older adults, children and teenagers, pregnant people, people who work outside or are active outdoors, people living in communities that are heavily exposed to local air pollution sources, and communities with existing environmental justice burdens. Next slide, please. AirNow also has some guidelines for protecting health from air pollution. This particular guide is for PM 2.5, but they also have one for ozone. The actions are similar for both sensitive groups and the general population, and really for both of those two air pollutants. Sensitive groups should consider limiting exposure to outdoor air, reducing exertion, and following action plans and monitoring symptoms starting at the yellow and orange warning levels. While everyone should take these precautions when we get to the red, purple, and magenta warning levels when the pollution is particularly extreme. Next slide, please. The most important thing that communities and municipalities can do to protect health from air pollution is to provide support to people, both residents at higher risk and all residents during extreme air quality emergencies. This is a brief list of things that municipalities and community groups can do to plan for and protect health from air quality, such as signing up for AQI alerts, sharing alerts with residents, distributing and linking to the DPH fact sheets, which I'll show soon, incorporate air quality into heat emergency planning, incorporate air quality into school and summer recreational activity planning and guidelines, designating clean air spaces during extreme pollution events, and having community and municipal web pages with information for residents to help them individually plan for and protect their health from poor air quality. Next slide, please. DPH has several fact sheets for both municipal officials and for the general public. The extreme heat and poor air quality is a climate hazard assessment profile that is designed for municipal officials and public health agents at the municipal level. And our wildfire smoke and poor outdoor air quality fact sheets are simple language format and are available in English plus 15 other languages used by Massachusetts residents. And these are also easy to share during air quality events or by linking like on a town website or in other information distribution methods. Next slide. The asthma prevention program at DPH is headed by the Bureau of Community Health and Prevention. And DPH also participates in the Massachusetts Asthma Action Partnership. And this is a sampling of some of the materials that are available. There is a toolkit for healthy schools, which addresses both outdoor and indoor air quality in order to prevent asthma among children. And a data to action project where select schools can sign up and get a walkthrough to spot air quality issues and will be given a report with recommendations, most of which are low cost or no cost and are just common sense ways to reduce the burden of asthma in the schools. Next slide. Finally, our Environmental Public Health Tracking Program, or EPHT, provides public-facing data and information on pediatric asthma in school-aged children, emergency department visits and hospitalizations for asthma and COPD, and modeled and monitored data for ozone and PM 2.5 across Massachusetts. The tracking website can be found on mass.gov, and this data is available for the general public. Most asthma data are available at the town level for hospitalizations and at the school level for school asthma. These data can help local health departments understand asthma patterns in their communities. The air pollution data is it's historic, and it is available at county, town, and modeled data is available at the tract levels through this website. Next slide. And thank you for listening.
Thank you so much, Kate. And apologies, folks, if you have been putting questions in the chat, I have not been seeing them because I couldn't figure out how to do that while sharing our slides. So we're going to turn it over now to two people to talk about something really interesting that has been done with the purple air sensors. And that is Billy Spitzer from the Hitchcock Center for the Environment and Francesca Bermudez from the Public Health Institute of Western Mass. Which of you is sharing your slides?
I think that'll be
I'll share
Francesca.
Okay.
Hi, everyone. I'm Francesca Bermudez. I'm a senior project coordinator at the Public Health Institute of Western Mass, and I'm really excited to share with you what we've been working on with these purple air sensors and the network we've created. So I think to start, this work really came to be really out of the high rates of asthma in Springfield and Holyoke and really the greater Springfield area. We were the asthma capital report made by the Allergy and Asthma Foundation. They deemed the greater Springfield area to be the #1 asthma capital in 2018 and 2019. And so to better understand what's going on, let's take a look at our air quality. Is it really why it's driving high rates of asthma and folks going to the ER for asthma and all the triggers and health consequences that air pollution can touch upon, like Kate mentioned. And so we started our Healthy Air Network project. So we are a collaboration of organizations, public health professionals, community members looking to understand the air quality in the region, increase climate resilience, and advocate for environmental justice communities, really statewide. And so we I think when it comes to a lot of the air sensor networks that have existed and exist, a lot of them aren't really community facing. You kind of have to have some background in air quality or some knowledge, very preliminary, sometimes understandable knowledge about air quality. And we wanted to make sure that our network is very digestible and understandable to bring the information, the data to the folks in a way that's easily understandable. So we provide this live air quality data for residents so that they can make informed decisions. We've analyzed some of the data to understand pollution sources, patterns, their impacts, which Billy will talk about soon, and then advocating for changes to policy changes and structural changes to address poor air quality and then equities linked to air pollution. So there's a lot of us on board for the Healthy Air Network, but I just want to shine light on our resident advisors. We have resident advisors in Springfield, Holyoke, Westfield, and expanding to really bring in that community voice to the project and help guide us in our activities and what we decide to prioritize. So I'm gonna kick it off to Billy to talk more about the expansion and some of our data stories.
Thanks, Francesca. I'm from the Hitchcock Center for the Environment, which is an environmental and climate education organization based in Amherst, and we work throughout particularly the Connecticut River Valley. As Francesca said, the network started really in Springfield and really focusing on Hampden County, particularly Springfield and Holyoke, and to some degree Chicopee and Westfield, because that's where really the highest asthma rates were, and we were seeing the highest particulate matter readings. And the idea with the Healthy Air Network is to provide really locally relevant, accurate and actionable air quality data. So we're more focused on how the data is useful to community residents on a day-to-day basis. Also how they can understand patterns in the data to help protect themselves, and also how the data can help identify where there are problem areas, and so to be helpful in terms of advocating for improved conditions. The network has expanded throughout more of Hampshire County, and Hitchcock Center has been working on that, and also into Franklin County, working with Phoebe and FERCOG and her partners. And we've also done some work to try to include a bunch of the towns in the North Quabbin region, which tend to be smaller towns, more rural areas, but also often end up having air quality challenges as well. And all of the sensors on the Healthy Air Network are Purple Air sensors. They are all calibrated in collaboration with our science partners at Yale School of Public Health. So there are correction factors applied to each sensor by matching them against some of the regulatory grade sensors that Addison talked about. And there's also a sensor dashboard that operates behind the scenes to identify problem sensors, and kind of in the way that Addison was talking about the AirNow site. In our network, there's usually a particular person or organization who's associated with kind of hosting and keeping track of each sensor. So if something is going off the rails, we know who to talk to. Sometimes they'll, plug it back in, or or have to reset something. And sometimes we have to actually replace the sensors. But that's the goal, to really to keep the sensors operational, so we can get really good day-to-day data. We can go on to the next slide, and I'll just quickly review some of the patterns that we've been seeing from looking at all this data. And on the Healthy Air Network website, there's a great page on all these kind of data stories in more depth. So this comes from analyzing many sensors. We have more than 100 in the network, looking at their very detailed readings over time, and looking for patterns. And so I'm just going to quickly highlight 3 different kind of patterns that we've seen. The first is looking at air quality changes throughout the day. And because one of the main sources of air pollution or particulate pollution comes from vehicle emissions, we see a peak in the morning during the morning rush hour, and we also see a peak in the afternoon rush hour. One thing that's kind of interesting about this is that the morning rush hour, the air pollution tends to build up and then pretty quickly get dissipated, and that is likely because what you start to see in the morning is the air warms up and you get more air mixing, so that pollution gets diluted. In contrast to the evening commute, when pollutants get emitted into the air, but the air is cooling down, becoming more stable overnight, and so those pollutant levels tend to rise throughout the evening, which is something that you wouldn't necessarily expect without looking at the data. One thing I want to also just highlight is that by and large, the air pollution levels tend to be in the good or moderate range. So that's the green or the yellow. Occasionally they get into the orange, particularly with wildfire smoke. But for Western Mass, at least, generally the air quality is pretty decent. And even though there are risks to going outside, unless you're in a particularly sensitive group, generally the benefits of going outside and taking a walk outweigh the risks of being outside in the air pollution. The second pattern that we see is changes by season, and we tend to see the worst air quality in the summertime, when we have a lot of heat that creates kind of these stable air masses where pollutants tend to concentrate. That also happens to be when you tend to get higher ozone levels, so it's kind of a double whammy there. But also we see worse air quality in the wintertime, and that tends to be because of burning of fuels for heat. And that's something that we see not only in urban areas, but also in rural areas where people are burning wood for heat, and you have that impact of wood smoke. Summer's also the time when we tend to see wildfires, and you get that impact of wildfire smoke as well. So the seasonal impacts are also really important to understand, both in terms of what kind of messaging you might want to be doing about reducing pollutant levels or how you might want to respond, and also to understand the nature of the problem. And then the third pattern is looking at the spatial variation of air pollution. And in this map, the red locations represent the locations with the highest air pollution levels, and then the blue represent the locations with the lowest air pollution levels. And what you tend to see is that the highest air pollution levels tend to cluster around the highway corridors, which represents both the impact of traffic and transportation, but also where the most industrial activity is. So you can see, as you know, generally, as you tend to move further away from the highways, you have less pollution. So that I-91 corridor, you know, in our area is a really big factor in where we see the worst pollution problems. So lots of data, but when you add it up, you can get some pretty interesting patterns. And with that, I will turn it back over to Francesca.
Thank you, Billy. So you can read more about these data stories on our website, healthyairnetwork.org, which I'll eventually put in the chat for you all. But really, what we've been working on for the past 18 or so months have been how can we turn our website, our network, into an app where folks can have this right on their phone. They can get alerts when some of the air sensor monitors are reading high, and things like that. So we have launched our AirWatch app a couple weeks ago. And we did this because our resident advisors, our community members on our board, they really wanted an app. They wanted this to be mobile friendly. Everybody can have on their phone and they can receive alerts when the air quality is bad. So with AirWatch, folks can access the local air quality data. They can get alerts when it's poor air quality outdoors. They can stay up to date with any of our updates or our news from our blog, and just make it, we made this really easy and simple to use. Now available on the App Store and the Google Play Store. We also have a web app version if folks want to try it out before they download anything on their phone. You can see all this either by scanning the QR code or visiting the website there. But building this app was a process in itself, but we really, the whole point of this was to do it with the community, and not just for the community. So at every stage and milestone for the app development, we always brought it back to our community residents, and also we would survey a general community feedback to get insights if the design is useful, if the alerts need to be changed, any of the different steps that we were creating for this process. We had community weigh in so that we made sure that this app would be useful for them. So we are now at app release, and it's already out, and we are working on doing some quarterly updates to the app, or updates as necessary. And we're just showing it off and promoting it for folks to have, especially as the summer months are coming up. And like Billy mentioned, air pollution, we have more air pollution events and things going on with the heat and wildfire smokes that could be happening, etc. So I'm actually going to quickly demo the app for everyone today, so that folks can see how it works and what it looks like if you haven't downloaded it already.
I'm a happy user already.
Awesome. So when you download the app, you'll go through a setup guide where you can choose a language. We currently have the app available in English and Spanish. You can set your default location either with your device's location services, or you can pick a town. So I'm doing this on my laptop, so this is hard to pick a location. My laptop's location services, so I'm just gonna pick maybe a Chicopee. I'm going to put in my age. So this is where you can get the personalized results, personalized alerts based on your age group and your health conditions. These are all optional if folks want to skip this, but this is how you can get alerts based on the threshold for the AQI. I don't have any of these health conditions at the moment, but I do want to get sensitive alerts. So I'm just going to check this off. And it'll go through like a wizard to show you what each face of the app is. So I'm just gonna exit that because I'll show you that myself. So currently this is the Springfield sensor that I tend to look at the most. I did pick Chicopee in the beginning, so I'm just gonna go to that one. It'll tell you what the AQI is, if there's any guidance for this. AQI is currently pretty good. It's safe for outdoor activities. And as we go higher on and we get to the yellows and the oranges and the higher we go on the AQI scale, there'll be other precautions that it would show up based off the EPA's guidance for the thresholds. It'll show what is in the air and what we're currently measuring on our network. And so each of these are expandable for folks can know what this is, what any tips and what are the indicators of what's good, moderate, and unhealthy. We are currently measuring also pollen on our platform, since pollen is an asthma trigger and it's actually a trigger to a lot of respiratory conditions. So folks can see like what the pollen levels are today, and it'll explain what it is, tips, and again the thresholds. The map tab gives you a map view of all of our air sensors. If let's say later on I'm planning on going to Holyoke, and I want to see what the sensor's reading and kind of get alerts for that sensor, I can do that by clicking on the sensor, tap for details. It'll give me a view of it and what it has been reading for the past couple hours. And then I can actually get alerts for this with the little bell on it. And I can see this in my home page if I wanted to. So the map, you can see what are our air sensors around. There's various map features where you can see wind direction. You can see like if you want a different view for the map. You can see what the past 24 hours have looked like as we go back in time. So you can see some of the sensors turn moderate and then go back to being green. And so there's some different settings there that folks can play with. Our community tab is where we link to our blogs, where folks can read up on other resources, see what's going on, any tips, any events we want to showcase, we'll put that here. If folks have any questions about how the data is collected, understanding more of what's in the air, how does air pollution affect health, things like that, we have this resources tabs where it'll link to our website where we have this information that currently lives there. And then lastly, the settings, if I want to change the language to Spanish, or maybe I want to do dark mode for folks that like that, or change my health information so I can get different types of alerts, I can do that. And if I want to set up my notifications where I don't want notifications at night, then I can designate that as well. So this is kind of it for what the app looks like. If I have various locations alerted, and here where it says Chicopee, I can hover and change my location at any moment, so I can look at what one sensor's reading, for example, and get a more detailed view. But this is our app. We have a feedback survey right at the top here, and it also exists in the settings where you can give feedback, and if you can let us know how the app works for you, if there's any bugs, if you have any suggestions or feature requests, we're happy to read up on that and see what we can do to make that happen. And that is really the app, and it's our little baby at the moment. And happy that it's out in the world for you all to use. I just have one last slide sensor on our map. Like Billy mentioned, the sensors on our network, we have them calibrated. And so if folks would like to see sensors near them on our map, we are promoting DEP's grant sensor a sensor grant where folks can get up to 5 free sensors through this. We would work with folks to see how they can get calibrated before they get installed, and they would get calibrated in Massachusetts to do that. Or if folks for community residents that maybe want to have their own sensor at their house, there are ways for folks to purchase their own independently, and we can get them calibrated before that. But currently, like Billy mentioned, we only have Purple Air sensors on our network at the moment, but we are open to hosting other types of sensors. We would just need to have an API key shared with us so that we can make sure that sensor gets added to our network. But all of that, we can follow up, and I'm happy to facilitate those conversations to see how we can get more sensors and other types of sensors on the platform. And that is it. Thank you both. Thanks everyone for being here and listening to us. And I'll throw it back to Phoebe for folks to have any questions.
Thank you so much. That was really great. Well, you've had a very quick tour of a whole lot of resources. If you are struggling to follow the links in the chat, don't worry. They will all be in the slides as well. And I just want to draw people's attention. The vast majority of the people who signed up for this, although not all of them, are from local health departments. And so I just want to remind you that among Kate's slides was a list of sort of things you can do, including personally signing up for this app, signing up for AQI alerts, making sure that you are sharing with your residents the fact, when there are alerts and what, and maybe encouraging folks to sign up for those alerts themselves, especially people like rec commissions, camps, schools, daycares, and then using the many fact sheets that are available. There's also, as Kate mentioned, some interesting data that is collected by school about asthma rates in schools. And so working with your schools who may have the highest asthma rates is another idea. Anyway, there were a lot of them on her slide, but Kate, did you want to add anything to that?
There really isn't much to add. But we do, the school data is, there's an annual survey that school nurses return. Most of them do eventually return the survey, and that's where the data comes from for school asthma prevalence. And it's for K through 8, so it's the younger kids, but it can be valuable for understanding what is happening, at least on a pediatric basis, by school. And also we have the asthma programs that DPH is doing with specific schools, as schools are identified based on high asthma rates and also high environmental justice populations, which is something our Energy and Environment Directorate outlines tracks, which census block groups that meet certain criteria for environmental justice. So that's something where each year they're inviting schools, and some are responding and getting those walkthroughs. And some of the ways to improve the air quality in schools can be fairly simple and relatively inexpensive. And that's kind of what the focus is get the low hanging fruit to improve the air quality in the schools. And some of that can also include, wind to, ventilation issues and such. So those programs are available.
Thank you. I took note of some of the questions, folks. First of all, I just want to reiterate that everyone who registered will get the slides and which include all these links that have been in here and contact information for everybody who spoke. So fear not, you will get all that. There's a lot of interest, Addison, in your air sensor grant program. Is there a deadline? Is there
No,
anything,
so
can random people apply or only municipalities? If you could just give a little more information, I'm hearing a lot of interest in that.
yeah, so eligible applicants are municipalities, community organizations, nonprofit, and tribal organizations. So you have to be one of those, or if you're not one of those, there's a lot of them that are I have found eager to help when you contact them. So find one to apply for you if you are not one of those. The application is currently open and we will keep it open until we're out of sensors. We still got a good bit left, so I wouldn't worry about that right now. Yeah, if you just Google, the link is very long. It is in the slides that Phoebe will distribute to everyone. But if you just Google Mass DEP Air Sensor Grant, it's the first thing that comes up on Google.
Thank you very much. And I will say for my fellow rural residents, do know that you require outdoor electricity and Wi-Fi that reaches outside. And this has been quite the surprise for our health department in trying to find spots to host it in many different places. It's been a challenge getting both of those things actually to the outdoors of a building and having it where it's protected but also can read the air. So there is very clear instructions from DEP about how to do it, but it is a little challenging. And just wanted to flag, if you are one of the many people interested in this grant program, that you won't show up on that app that Francesca and Billy were talking about unless your sensor is first calibrated at Yale. So do get in touch with them if you are awarded these things that you'd like to be able to have your sensors show up on that app. Another question was asked about whether the monitors, so the much bigger sensors that you described at the beginning, Addison, that allow Massachusetts to comply with federal rules about monitoring the air, are those available or useful in any way to local public health for local enforcement?
So the purpose of the monitors is to collect regional air quality. And because of that, we have them, we only have 26 throughout the state, and they're strategically placed, and those locations are determined by a collaboration between Mass DEP and the EPA. So in terms of providing local information, you're only going to, the intention, quick answer, no. If you happen to have one in your city or town, then you can use that for that purpose, but that is not what they're intended for and not what they are out there to collect data on. They're very helpful when somebody asked about when there's air quality events like wildfires and stuff, how they can be helpful. That is what allows us to determine if we actually experience exceedance days. So it is the same data that's used for the forecast, so it helps us to anticipate that and notify the public when we are anticipating bad air quality days. But actually measuring the data, it allows us to definitively say if we experience an exceedance day in comparison with the NAC.
Thank you. That's helpful. And there was a follow-up question in the chat about where to cite them if you have them. And Billy did put a link in about sort of citing guidance in case anybody wants to look at that. The other question that was asked, I think, is maybe more for Billy and Francesca about, do you have examples of how people are using the app to change their behavior that would be helpful to people who are listening?
Yeah, so a lot of folks, well, I wouldn't say a lot of folks, but I've heard both in community events from our resident advisors, and from our feedback survey that's currently still open and will be open for as long as the app is running, that I've heard folks before they go out or they have plans to have an outdoor activity, they check the air pollution, the AQI data and also the pollen data to see if they need to carry their allergy meds or their inhalers with them. And that has been, like we love to hear that because that's kind of was the purpose of this app. We've seen folks like the wind direction feature on the map because they can kind of hypothesize what the air pollution, how it can travel and be like, well, if it's high in Holyoke, that would eventually make its way down to Springfield. Let me make some decisions about my day to day. So I've heard wind direction being a favorite thing from the app. And then I think the third thing is the what to do when the air quality is poor. So we haven't gotten alerts because the air quality hasn't been extremely high or worrisome yet. The summer's starting, so it's kind of in the process, but folks are intrigued to see how the alerts work and are kind of looking, I wouldn't say looking forward to getting them, but seeing how they can be alerted in a timely manner and see that guidance of what to do when it's poor. That alongside we oftentimes when there is like we posted for the unhealthy heat alerts, and when eventually we have air quality alerts, folks can see on the blog some information about what the alert is saying, linking to the Mass DEP forecast and all the other resources folks can look at, and then what they can do for themselves, whether that is limiting time outdoors, wearing masks, running an air purifier in their home. The other materials will showcase for folks to have as support, because like again we want this app to be something useful for the community, to really understand the data and what they can do about it and not just be scared about it, I would say.
Thank you so much. And I want to say that the Public Health Institute, the partnership that they have around Healthy Air Network, has addressed all kinds of stuff around asthma. There's just some really creative and interesting asthma work that has happened in Springfield since that, alert of being the asthma capital of the country, which fortunately it isn't anymore. But I just want to call out for anyone else who's working on high asthma levels that they're a great resource. There is a question in here that has been answered about whether you can use these sensors for indoor air quality, and there are separate ones, it looks like, that monitor indoor PM 2.5 from Purple Air. That one can buy. You can't take the ones the state is giving away for free and do that because the purpose of them is for outdoor air. But if anyone is interested in that, I would draw your attention to the chat with the link about the indoor air sensor that Purple Air sells. Okay.
Go ahead.
Yes.
I would
No,
say
go
one
ahead,
thing I would
David.
just add is I think one of the uses that we use the data for at the Hitchcock Center is we run a summer camp, and we have to decide on a day-to-day basis, are kids going outside for how long? Do we have kids who are sensitive? What do we need to do? And so the local real-time data is incredibly helpful. And then the other thing that is really useful are the forecasting tools, which really are both the DEP forecast, which is incredibly useful, and also the wind direction map, and the regional patterns can show you if there's something coming your way. And that's particularly useful around wildfires. But also, if there's like a weather front coming through, that's really helpful. So from a protection of public health standpoint, that forecasting I feel like is really useful. And you can sign up for a daily email from DEP to get a forecast for the next day. Really simple. And I would definitely recommend that.
And yeah, that is our sort of last section here, is to just see if there are any other resources our presenters or anyone else on the call wants to share. And it looks like Kate is sharing a guide about activities during air alerts from California that could be really helpful for people dealing with the vulnerable populations and everyone. Any other things? Kate, do you want to say anything about that, or do any of the other presenters want to share any final thoughts, resources, tips? Okay. Any final questions from the group? If not, we will send you back out to hopefully download the app and apply for the air sensors. And we'll follow up in the next week with a link to a YouTube recording of this and all the slides and links. And thank you all so very much for all your hard work to take care of the health of our residents.
Thank you.